Hello, I welcome you all to our special conversation in commemoration of World Spina Bifida and Hydrocephalus Day. My name is Grace. I'm a nurse currently with the House of Hope in Kumasi, Abrepo, a place dedicated to supporting children and families affected by spina bifida and hydrocephalus. I have the honor to be speaking with the Executive Director of SBH Foundation Ghana. This is not just a mere date on the calendar, but a reminder of strength, struggles, and resilience of persons affected by spina bifida and hydrocephalus. So stay glued to your device, and together we will explore the significance of this day, challenges faced, and the work done to bring hope and lasting change in our communities. I'm delighted to have here with me Dr. Patrick, the Executive Director of SBH Foundation Ghana. Mr. Patrick, welcome to the launch of World Spina Bifida and Hydrocephalus Day.
Thank you very much. You're looking good today.
And how about yourself?
Welcome.
Okay. Before we begin, let me take this opportunity to sincerely thank you for the remarkable work you're doing, not only in Ghana, but for persons affected by spina bifida and hydrocephalus worldwide. Championing this cause hasn't been easy, but yet we continue to push through and project their voices onto the global stage. I must recommend you for that. Thank you so much.
Thank you.
For the sake of our cherished viewers and listeners, could you kindly introduce yourself?
All right. Thank you very much, Madam Grace, for such a wonderful platform that you have given to me. I am Patrick Esman, as you called me. I'm the Executive Director of the Spina Bifida and Hydrocephalus Foundation Ghana. I work with the Child Health International as the Information and Communication Director, and then also the House Manager for House of Hope. I've been advocating for persons with spina bifida and hydrocephalus for the past 5 years, and we've been doing a lot, trying to create awareness about spina bifida, seeking for support and assistance for persons with spina bifida and hydrocephalus, and trying as much as possible to make spina bifida a national topic, calling for timely intervention for persons with spina bifida and hydrocephalus in terms of their management. So basically, that is what has been keeping me active and engaged for these past years.
So, Mr. Patrick, what's the significance of celebrating World Spina Bifida and Hydrocephalus Day?
All right, so in 2012, on the 25th of October, the International Federation for Spina Bifida and Hydrocephalus met in Guatemala, and they established this day that as a day to advocate for persons with spina bifida and hydrocephalus across the globe. And the whole idea is to raise awareness about spina bifida, because before that, there wasn't any international day to celebrate these children, to raise awareness, and to advocate for their rights. So the International Federation for Spina Bifida met in 2011 at Guatemala, and they established this day, that's 25th of October, to celebrate persons with spina bifida and hydrocephalus. So the first day we celebrate this was on the 2012. That was done in Europe, Istanbul, and after that, this program has been celebrated across the globe. SBH Foundation Ghana is a member of the International Federation for Spina Bifida and Hydrocephalus, and in 2020 we had the first celebration of spina bifida and hydrocephalus here in Kumasi, which was led by me and my team, and we did it at Hope Exchange Medical Center. And from there, we have been doing this event each year across the country. On the 2021, we had it at Accra at the Rich Hospital, and then 2022, Accra Rich Hospital. But here, 2025, we are having it here in Kumasi. So the whole idea of we doing this program is to raise awareness about spina bifida and hydrocephalus, trying to change the misconception of Ghanaians about this condition, because many Ghanaians have wrong misconception when we talk of spina bifida and hydrocephalus. Many call it ASFRAM, and I believe that the ASFRAM that we call the condition name might be a different condition that have been interpreted or understood in terms of spina bifida and hydrocephalus. So in 2020, we started our campaign, Change Your Misconception, which looked to address the issue of misconception of spina bifida and hydrocephalus. And then from there, we are advocating, trying to change people's mind on this condition. We also celebrate this day to make spina bifida a national topic. Before 2020, you hardly hear of spina bifida and hydrocephalus. Apart from the people within the medical field that knows about spina bifida and hydrocephalus, the ordinary Ghanaians do not know. So when we launched the celebration of spina bifida in 2020, then gradually we're trying to let it be in the Ghanaian system where the ministries, the stakeholders that have direct and indirect relation to spina bifida and hydrocephalus condition become aware of the existence of this condition within our health system. So the celebration of spina bifida and hydrocephalus, one, we are also trying to raise spina bifida and hydrocephalus as a topic within the health system as well. It is through this program too, we are trying to seek for social support and assistance for persons that have this condition or families that have children with the condition. So these are some of the significance, if you ask me, about the celebration of spina bifida and hydrocephalus, I would like to put across to the audience.
So I must say it's been awesome and challenging as well.
Yeah, it has really been very challenging for years, but at least we are on top. We are trying our best to make it work in our country.
Okay. So what has been the toughest challenges children and families affected by this condition face in Ghana?
Yes, in Ghana, I would say one of the toughest challenges that we are facing is discrimination and stigmatization. That is one. And this has gone a very long way to even affect the management of spina bifida and hydrocephalus in Ghana. Because once somebody gives birth to a child with spina bifida, because of the traditional belief and our understanding of the condition, the parent is either they try to hide the child from the public, and they try as much as possible to find their own way of taking care of the child. And this misconception has really gone a very long way to affect the management of the spina bifida and hydrocephalus. Another challenge that I will mention is financial. Managing spina bifida and hydrocephalus comes the whole financial responsibilities on the family. And it's unfortunate that many of these children are giving birth to parents that are not well to do, or basically I would say they are within the low income belt. And sometimes when they hear of the cost of the surgery, it pulls them away, and they decide to seek for maybe traditional intervention or whatever it is.
Okay.
And one thing I would say is that our cultural belief is also playing a very critical challenge here.
Okay.
Because we believe that children born in such conditions are cursed, and the beliefs around it discourage them from even coming out. So the traditional belief or the cultural belief of this condition has really placed a very significant challenge in managing and treating spina bifida and hydrocephalus in Ghana.
As a nurse, I've been hearing of Asram. How does it come in here? I mean,
Yeah, so that's what I said earlier in my introduction, that many people believe this condition is cancer. Well, I don't know. I am an account, but I think the Asram is a different condition. Or, however, it might be the same of hydrocephalus that they call it Asram, because from understanding from the meaning of the astrum is an accumulation of a fluid in the head of the child. So once there's an accumulation of a fluid in the head of a person or of the child, basically they relate it to the astrum condition, which is seem to be a spiritual condition that needs a spiritual remedy to rectify whatever has happened to the child. But to me, from the medical background, I believe it is of different meaning and different understanding. So if you ask me, that is what I would say. We are here to prove and to know more about that.
so are you trying to say that using herbal concoctions and all that does not help in managing a child with spina bifida or hydrocephalus?
It's a big no to your question, because there are several times and there are several moments that families have tried to use herbal concoction to address this condition, and it hasn't helped. There are so many children that have been sent to our facility And when you sit down with the parent and you try to have a discussion with them or talk with them, they will tell you when the condition set in, we took our child to see a herbalist or a fetish priest or whoever to try to use herbal concoction to address the situation. But for years of trying or months of trying, they see no improvement. So it is totally no to use herbal concoction to address spina bifida and hydrocephalus or to manage spina bifida and hydrocephalus. It's totally medical intervention that is needed. That's the primary intervention is surgical. So taking the child to the surgery, to the hospital for surgery to be done is the primary intervention to save the life of the child and to reduce the disability that will come if not managed.
Okay. So the last time a woman approached me and was like, Auntie Ness, and you're always saying, Mom, my dry the best of Sadron. Surgery in Kwana, ye bayamana kwana. What's the take on that?
So what I would say is that yes, for now, as it stands, there has not been any medical or drug that is used to manage or to treat the condition. The only available remedy or intervention for spinal bifida and hydrocephalus is surgical at the point of contact. See, when we talk about the spinal bifida, it's an accumulation of fluid in the brain. And it's like, let me use this as example. I always use our washroom that we all have as an example when I'm trying to explain this condition to people. It's like a fluid has been, a water is being stored in your washroom. When you bath your washroom, the pathway of which the fluid passes, the water passes through is blocked.
Okay.
And now when it is blocked, what happened? You need a plumber to come to either relay the pipe or try to push whatever has blocked the pipe out of the pipe so the water will flow.
Yes.
And it's the same scenario that spina bifida, hydrocephalus comes with.
Okay.
So once there is a blockage or is either communicating there is excess production of the fluid in the head, then what the surgeons need to do is to create a pathway for diversion of the CSF or the fluid to come out of the brain. So the brain will be release of the pressure. So that is a simple explanation I can give to your question. But as it stands now, we are still, research is going on. People are still trying to find the best way to solve this issue because nobody wants surgical styles and cutting under the knife and all those things.
Yes.
But as it stands now, the only primary intervention or the intervention there is first surgical and then the others follows.
So, Mr. Patrick, what inspiring activities and highlights should we look forward to in this year's SBH Foundation Day celebration in Ghana?
Well, so this year we have 5 activities that we have planned to have. Okay. First, as we are doing today, launching the event, calling on corporate institutions and agencies, the media stations, and individuals to join effort with us to create awareness. So what we are looking at is that whilst you watch our video, we are calling on the media stations, engage discussion on spina bifida and hydrocephalus at your stations. Let people that are also watching, we are also inviting you to share posts on spina bifida and hydrocephalus and on your social media platforms because nobody knows when you give birth to a child with a spina bifida and hydrocephalus. So let's all come together to create awareness about this, spina bifida and hydrocephalus, and then we do the education as well. So first, we will release this statement or this video that we are doing, our interview that we are having. I'm happy with you, and then we will be doing media station visitations. So we will go to the TV station, the FM stations to talk about spina bifida and hydrocephalus. So I use this medium to also plead with all the media stations to invite us to come and talk, do public education about this condition as well. And then there's going to be infographic materials that we're going to release in the course of this month. So flyers will be sent out giving us short messages about spina bifida and hydrocephalus. And then again, we would have a derba about spina bifida and hydrocephalus at the House of Hope on the 25th. So at the derba, we are bringing on board stakeholders to come for us to explore some barriers. And then also at the derba, you showcase the talent and of children with spina bifida. and then some success stories about some of the, because some people believe that these children do not live, and there's no hope in these children. So we want to showcase them that there's hope for children with spina bifida and hydrocephalus, and most of them come with a very beautiful, unique talent. There are others that want to be doctors. There are others that want to be musicians, and we have some recordings about. I mean, some recordings of some of them who have some songs that they have composed, and we'll be showcasing them at the Durbar or at the on the 25th as well. And then you'll be also be having a lot of this gathering of this meeting or interview on podcast or our Facebook Live. So you tune in and you join us in this year's activity. So,
Mr. Patrick, beyond one day of awareness, how can governments, community, and the ordinary Ghanaian show genuine and ongoing support for persons affected with this condition?
So now, this program is not the end of advocating for persons with spina bifida and hydrocephalus. After this event, there are going to be series of spina bifida advocacy activities that will go on. Every year we are doing it, and we continue to do it till the kingdom come. What we are expecting from corporate institutions and the government is one, government coming on board to partner with us to be able to advocate for the prevention of spina bifida or neural tube defect. It is said that 70% of occurrences of spina bifida can be prevented by adequate intake of folic acid. And is one of the activities we really want to pick up or to do after here to advocate for the prevention or prevention campaign for spina bifida and hydrocephalus. So we are looking for the government to join effort with us to advocate on this campaign as well. Again, we are also pleading with people that has children with such condition to come out in their masses so we see them, because if you hide these children, how would we be able to change misconception? How would we be able to deal with the issue of stigma and discrimination? So we are asking the mothers to fully come out. Once you come out, you join effort, and we see the masses, and we be able to do that. One area we really want to go into is research, because as it stands now, Ghana do not have any adequate data when we talk of spina bifida and hydrocephalus. So it becomes difficult to quote figures. And when you are trying to engage philanthropists, donors, and sponsors, one of the things that they ask, how many children are spina bifida in Ghana? What data do you have? You don't have it. And it becomes difficult to engage sponsors or donors out there to come in to help us in the management of spina bifida. So I'm using this platform to speak with the government, to join effort with the SBA Foundation Ghana, to go onto the ground, onto the field, to get the data about spina bifida and hydrocephalus. There are many people that have not been captured, and statistics speaks a lot. That will help us to be able to give the timely intervention that we want to give to persons with spina bifida and hydrocephalus. Another area is support. We have inadequate support system available for persons with spina bifida. Other conditions are being enrolled on health insurance, but spina bifida and hydrocephalus is not enrolled on health insurance. Managing spina bifida is a lifelong condition,
right?
And the parent have to pay a lot of money to be able to take care of their kids. So we are asking for assistance. We are asking for collaboration, so we would be able to reduce the cost of at least the surgery for the children. As an organization, we are doing our best. We provide a shunt and other medical equipment, but that alone does not reduce the cost of surgery. So after this event, we are looking at joining effort to be able to address some of these little issues that managing spina bifida and hydrocephalus in Ghana or advocating face in Ghana.
So, Mr. Patrick, if I get you right, does that mean one has to take a folic acid once the person says she's pregnant, or we can take it at what age?
Well, so with the issue of prevention and with folic acid, according to World Health Organization, every woman within your childbearing age is to take folic acid 400 microgram per day.
Okay.
The reason is this. In our local setting, nobody plans for pregnancy, or even if they do, many do not plan for pregnancy. We just it just happened on our way, and at times the body is not in a full preparation with all the minerals or the need. I mean the efficiency or the whatever to accept. I mean to receive the baby, the woman. So World Health Organization is saying that once you are within your childbearing, start taking folic acid at least 400 microgram per day to prepare you so that we don't have the occurrences of neural tube defects often in the country or spina bifida. So if I'm to talk about that, but I think it's a whole topic that we need to delve into it very well. Maybe somewhere in January, which is World Folic Acid Awareness Week, we will have time to delve much into this topic.
We are looking forward to that date. So, Mr. Patrick, your final words to the general public and what we should look out for in the future celebration of World Spina Bifida and Hydrocephalus Day.
So what I would say is this. I will quote this Ghanaian saying, "Yensum yensum oninipa." Without people, we can't change misconception. Without the masses, we can't deal with the stigma and the discrimination. So we are calling on board all Ghanaians and even people outside Ghana to join effort with the SBH Foundation Ghana to be able to address this issue of stigma, discrimination, and to advocate for the right of persons with spina bifida. One of the things that as an organization we are looking for is to make sure that these children have timely access to healthcare and intervention. Delay in healthcare access has really impacted negatively on these children, making these children develop that big head that we see on the street. Our goal is to, once you give birth to a child, once the condition is diagnosed, surgery is done less than 2 weeks so that this child does not incur a lot of disability and the death rate will also reduce. So this is my last word. Let all come together to save life of persons with spina bifida and hydrocephalus in Ghana. And this year, Hydrocephalus Day, I am calling on board all stakeholders and everybody to join effort with the SBH Foundation Ghana to observe Spina Bifida and Hydrocephalus Day. If you are within Kumasi, I invite you to the House of Hope at Abrepo Highways. Our contact number is there. Call us and join us to observe this day and to celebrate persons living with spina bifida and hydrocephalus.
Well, thank you, Mr. Patrick, for sharing these powerful insights with us. And as we mark World Spina Bifida and Hydrocephalus Day, may we all remember that awareness must lead to action and compassion to inclusion. Every child deserves dignity, care, and a future filled with hope. On behalf of House of Hope and SBH Foundation Ghana, we invite everyone from governments, communities, and individuals to stand with families and children affected by this condition, not just today, but every day. Thank you for listening, and let's build a community or a society where everyone is included and no one is left behind. Thank you so much for joining us.